Malignant hyperthermia is a syndrome affecting skeletal muscle in which triggering agents initiate a series of biochemical changes that result in hypermetabolism, acidosis, and electrolyte imbalance. Presentation of the syndrome may vary. It may be subtle, with slowly rising end-tidal CO2, mild tachycardia, and tachypnea. Or it may be explosive, with onset of severe tachycardia or bradycardia, dysrhythmias, hypercarbia, muscle rigidity, and cardiac arrest. Either presentation must be diagnosed and treated immediately, or the result could be catastrophic. This videotape and accompanying emergency response plan manual have been developed to help you prepare for the efficient and effective management of an MH event. This program is made possible by the Malignant Hyperthermia Association in cooperation with Dr. Darlene Mashman, Assistant Professor of Anesthesia at Emory University School of Medicine in Atlanta, Georgia. The successful treatment of a patient with malignant hyperthermia depends on several key factors. Early recognition of the signs and symptoms. The rapid institution of dantrolene. 36 vials must be readily available at all times. The coordinated effort of the nursing, anesthesia, and surgical teams to implement the M-House treatment protocol. The response plan presented to you in this manual should be used in conjunction with the M-House treatment protocol. It should be employed as a tool to help coordinate your staff to implement the M-House treatment protocol. Tasks are assigned to team members to improve efficiency. These tasks are outlined in a checklist format on a worksheet to ensure completeness. With this response tool in place, multiple therapies are instituted at the same time. A mechanism of initiating the plan and OR personnel available to respond should be identified at your institution. Review your manual soon after receiving it. If assignments must be adjusted to meet staffing availability at your institution, then check your worksheets for completeness. Periodic drills have been found to be beneficial and remind the staff of their roles. Frequency of drills depends on staff experience and turnover. The purpose of the worksheets is to ensure all therapies are initiated efficiently during the time of crisis, so the anesthesia care provider can focus on patient treatment. Malignant hyperthermia is an uncommon, treatable syndrome. It can strike at any time, most likely when least expected. Be prepared. Your manual was customized by M-House to help meet the needs of your hospital. You must review the material for completeness and accuracy. You should implement the plan in a drill and make any changes to improve efficiency prior to a crisis. In this video, we will review and enact the response plan already in place and found effective within the Department of Anesthesiology at Emory University. We have included a segment on the efficient dilution of dantrolene and a review of the supplies kept in our cart. Your staff should all be aware of the location of your MH emergency cart or kit.
That was a smooth rapid sequence induction. Breath sounds are equal and bilateral. Tube is secure. Vital signs are normal. CO2 is 30. Heart rate 60, blood pressure looks great, she's oxygenating well. I'll be right next door. We have a case to start. Call me if you need anything.
All right. I think we've got a problem here.
What's wrong?
The patient's end-tidal CO2 is up. The soda source is turning blue rapidly. She's tachycardic. I think we've got a malignant hyperthermia response. I'm going to turn off the agent and hyperventilate with 100% oxygen while I call for help.
What seems to be the problem?
I believe we've got a malignant hyperthermia reaction.
I see the tachycardia, her blood pressure is labile, her skin is mottled and warm, the canister is warm. I agree. I do think this is malignant hyperthermia. Could you please initiate our response program with the overhead page?
Yes.
And now, let's change that lactated ringers out to normal change.
Attention all personnel. Malignant hyperthermia in OR 11. Malignant hyperthermia in OR 11. Malignant hyperthermia cart to OR 11 staff. Malignant hyperthermia card to OR 11 staff. Charge nurse to OR 11. Charge nurse to OR 11.
This hospital has found that the overhead paging system is the most efficient method of initiating the response plan. Another method of getting personnel and cart to the OR to help may be more appropriate for your institution and should be incorporated in your response plan.
For now, let's change that lactated ringers out to normal saline. We need to get that dantrolene in the room because that is how we will treat this fulminant episode.
When a patient is found to have malignant hyperthermia, know your role in the response plan. Get your worksheet from the anesthesiologist or charge nurse in the OR. Perform the tasks outlined. This will allow the anesthesia team to focus on the resuscitation of the patient and treatment using the M-House MH protocol. The team receives their worksheets and begins to swing into action, performing assigned tasks independently under the direction of the anesthesiologist. The time to intervene can be greatly reduced using this method.
I want you to perform these tasks and get back here right away, okay?
I would like for you to mix the dantrolene. There's a dantrolene worksheet in this packet. You can see the index and get it. I can get it.
Here's your worksheet.
Thank you. Blood gas lab? Yes. We have an emergency in OR 11. We'll be sending serial stat labs. Thank you. Pharmacy? Yes, we have a patient with malignant hyperthermia crisis in OR 11. We will be using our supply of dantrolene, so please be prepared to supply more if needed.
It looks like we have an adequate supply of dantrolene in addition to what we have in the OR.
Our anesthesia care provider will call you back. Thank you.
Doctor, the 75-kilogram patient will need 175 milligrams of dantrolene. That's 9 vials. I'll start mixing now. Thank you.
Mixing the dantrolene with preservative-free sterile water requires at least one dedicated person. A 70-kilogram patient may require 35 vials before the signs and symptoms of MH are controlled. Consult your M-House guidelines and the package insert for dosing instructions. There have been several recommended methods of getting the dantrolene into solution, such as opening the vials, dumping the powder into a container, followed by the correct amount of sterile water. We used another method. A liter bag of sterile water is spiked with a fluid transfer set. A 60 milliliter syringe is added to the end of the set at the stopcock. A vial of dantrolene, which has been spiked with a mini-spike dispensing pin, is also added to the stopcock. The vial is then vigorously shaken to dissolve the dantrolene. The drug is now ready for use. Because the team is practiced and organized, they work smoothly to perform the required tasks. This case represents a hypothetical patient, and treatment may vary depending on individual cases. The dantrolene is prepared, and the required dose of 2.5 milligrams per kilo is being administered. The wound is irrigated, and lavage of body cavities with cold saline is in progress and will continue until the temperature begins to stabilize and drops from its high of 40 degrees centigrade. Insulin, glucose, and bicarb are on hand in the cart and are administered. The patient is still very tachycardic. Blood gases are coming back now, and in this case indicates, as expected, a mixed respiratory and metabolic acidosis. As the anesthesia care team treats the patient and the treatment begins to take effect, the T waves become less peaked. The heart rate is coming down, and the temperature is now down to 38.5 degrees centigrade. The cold lavage is slowed, and the patient begins to look better. The surgeon now closes the wound. The dantrolene is continued.
Doctor, your number 9 vial.
She is back in normal sinus rhythm. Her heart rate is 60. She has received 9 vials of dantrolene, and the remaining dantrolene must remain near her in the event of recrudescence. The PACU has been notified, and the MH cart will follow her into that unit.
Okay, we're at a point. Let's review what we've done.
At this point, the anesthesiologist reviews what has been done and what needs to be done. Volatile anesthetics have been turned off, Patient is ventilated with 100% oxygen at a flow meter setting of 10 liters per minute, tidal volume 10 milliliters per kilogram, at a frequency of 15 breaths per minute. MH cart is in the room. Dantrolene is being mixed. Arterial lines are in place for hemodynamic monitoring. EKG and end-tidal CO2 constantly monitored. Patient cooled with axillary ice and cold saline lavage of bladder through a Foley catheter and gut via NG tube. Urine sample to the lab. Hyperkalemia has been treated. Acidosis has been treated. Now, second blood gas and other baseline labs are being sent. The MHouse MH hotline has been contacted, and the case has been reviewed with the MH expert. Our specialty cart contains the recommended supplies of the Malignant Hyperthermia Association of the United States and additional equipment to improve patient treatment efficiency at our institution. On the top of the cart, you will find two 3-ring notebooks, which contain the worksheets and the Malignant Hyperthermia Association of the United States protocol. Outside of the cart, you will find an oxygen tank and key, pediatric and adult circuit and ambu bags, and sharps container. The first drawer contains 36 vials of dantrolene, 2 fluid transfer sets, 2 mini spike dispensing pins, 5 60cc syringes, and 2 liters of preservative-free sterile water to dilute the dantrolene. The second drawer contains monitoring and cooling equipment. The third drawer contains adult and pediatric central venous access lines, carrier fluid, ventilation monitoring supplies, lab request forms, and the North American Malignant Hyperthermia Registry Adverse Metabolic Reaction to Anesthesia report. The fourth central drawer contains the nursing supply bag. The items are instrumental in cooling the patient. Inside of the bag, you will find Foley catheter, urine meter, a TUR irrigation set, irrigation tray with piston syringes, 3-way irrigation Foley catheters in multiple sizes varying from 23 French to 24 French, Malicant rectal tubes in sizes appropriate to treat your patient population. There is a large sterile drape for wound covering, large and small plastic bags to contain ice. The tray containing all of this equipment can be used for retrieving and holding ice as well as chilled solutions. The left side drawers contain resuscitation drugs, vasoactive drugs, as well as the diuretic furosemide. The right side drawers contain sampling containers, arterial line catheters, and intravenous catheters. See the supplies checklist found in your manual for a detailed listing of recommended items.
And the ventilator is on the way.
Thank you. As you know, this is a patient with malignant hyperthermia.
At this point, the patient is transferred to the PACU, where the anesthesiologist reports the patient's condition, state of treatment, and orders. This patient has had a fulminant episode of MH. She will be in intensive care for the next 24 to 48 hours.
I'm glad we got to meet today to discuss that recent malignant hyperthermia event in the operating room. I thought things went very
A team meeting should be held following an MH event to review the handling of the case in order to incorporate improvements and refinements into the MH emergency response plan.
Ran smoothly.
The reason I asked you to...
The anesthesia care provider should make every effort to follow up with the patient and family, to counsel them about MH, to provide them with a letter for their family physician, and inform them about the services of the Malignant Hyperthermia Association, including its MH Emergency Identification Tag Program and biopsy centers. We have reviewed our institution's response plan. We emphasize the importance of knowing where your supplies are located, the importance of knowing your role, the importance of having a plan in place before the crisis occurs in your institution, and the importance of performing periodic drills to improve efficiency. We also presented our method of rapid preparation of dantrolene. M-House has tried to prepare a response plan that will meet the needs of your institution as closely as possible. They anticipate that when you review the plan, you may need to make some subtle changes so it will meet your needs exactly. It will be important for you to present a lecture on malignant hyperthermia, present the plan to your staff, and run through a drill to determine the changes that you will need to make it work efficiently.